Hi, everyone. Welcome back to the Breast Cancer Podcast. Hello, I'm your host, Dr. Deepa Halaharvi, a fellowship trained breast surgeon, and also happen to be a breast cancer survivor, thriver, and a warrior, living my best life. As you know, breast cancer affects millions worldwide, touching lives in a profound ways. Whether you're someone facing a diagnosis or a supporter seeking information or just eager to learn more, this podcast aims to be a beacon of understanding, hope, and empowerment. I'm here to talk about all things breast cancer, from surgery to survivorship, as well as high risk for breast cancer to metastatic breast cancer. My goal is to provide you with reliable information, share inspiring narratives, and foster a supportive community. I know firsthand the challenges breast cancer diagnosis brings. Throughout this podcast, I will give you strategies to handle difficulties that arise from cancer diagnosis. We'll have insightful conversations with medical experts, researchers, survivors, caregivers, and advocates. I will tackle topics that impact our lives as cancer survivors. My goal is to educate you and empower you to live your best life. I definitely have. Well, let's get started. Right. Welcome, everyone, to the Breast Cancer Podcast. I have Amy Durtschi. Did I say your name
Yes,
correct?
you did.
Okay, wonderful. I can't wait to talk to her. She is a psychotherapist here in Columbus, Ohio. And as we are coming upon holidays, it's really tough for cancer patients to deal with holidays, whether if you're newly diagnosed cancer patient or if you're going through active treatment or if you've had a loved one, a loss of a loved one during holidays, as I have in the last few months. So I'm really excited to have Amy here to give us some tips on how to navigate through holidays with all these losses this
Yeah.
encounter.
Well, thank you for having me. And it's such an important topic.
Yes.
There's a lot of pressure that comes with this time of year, with a lot of expectations. And when you're feeling, and I'm also a breast cancer survivor, when you're feeling different in your own body, perhaps, or in circumstances with loved ones, expecting you to do the same things over and over that you've always done with the same vigor, with the same excitement,
Yeah.
joy, volume is kind of unrealistic.
Yeah.
So I help people a lot of times just manage expectations that they have for themselves.
Yeah. Yeah.
So I'm excited to the chance to talk about this. I talk about this all month long in December.
Yes.
I do.
Yes. So, okay, I'm a newly diagnosed breast cancer survivor. So, what advice would you give me on how to navigate through holidays?
So one of the things I tell people a lot is if you have a headache today, most of you are going to have your go-to either Advil, Tylenol,
Mm,
Excedrin, Benadryl. There'll be something that you'll know what to do.
yeah.
And it won't scare you.
Yeah.
And it'll be annoying. It might be debilitating
Yeah.
but it's not going to be put you in a panic attack,
Yeah.
most likely.
Yeah.
Anxiety is the fear of fear.
Yeah.
And so, for a lot of people, it's just as much about being afraid of those feelings that they don't know what to do with and they don't know how to stop them
Yeah.
than it is anything. So, I always say to people, this is a great time to think about the things that bring you back to baseline, to status quo, that calm anxiety, much like Advil, Tylenol, Excedrin with a headache.
Okay.
So, it doesn't scare you.
Yeah.
So if you start to feel overwhelmed,
Yeah.
let's say you're at a party or with family members
Yeah.
and everyone's asking a lot of questions.
Yeah.
You are shopping and
Yeah.
it's overwhelming. And if
Yeah.
you're feeling anxious and your nervous system is activated
Yeah.
anyway,
Yeah.
sometimes that'll tip you over the edge and you'll start to feel almost panicky. You'll start to have physical symptoms of anxiety. You might get hot, feel palpitations, GI upset, headaches, numbness, tingling.
Yeah.
A lot of that is, well, all of that is a physiologic response to
Yeah.
anxiety.
Yeah.
So I always tell people, what's your go-to? What's your Advil for anxiety?
Okay.
Figure out what works for you. Is it journaling? Is it taking some time alone? Is it movement?
Yeah.
Is it meditation? Is it just pulling back and setting boundaries and
Yeah.
expectations for yourself that are more realistic than
Yeah.
the go, go, go that you've always been used to.
Yeah.
And as a young mother, for those young mothers out there,
Yeah.
that's difficult if you
Yeah.
have kids wanting all the stuff.
Yeah.
But at the end of the day, they really just want you. As a mom of 3 grown children and grandchildren, they just want your
Yeah.
time.
Yeah.
So, the pressure that we put on ourselves as women is
Is
a
a
lot
lot.
of it on ourselves
Right.
that we can remove a little
Right.
bit.
Right. So, I usually say, patients will ask me, I need to tell everyone about this diagnosis. And is that really important to tell everyone and share? For me, I remember when I was diagnosed, telling each person, I replayed the story of what happened. So replaying it each time I would tell people.
Mhm.
And I think I almost think that's so hurtful because you're replaying it over and
Mhm.
over and over again, especially when you don't have the answers, or especially if
Right.
you don't know what's going to happen to the next
Right.
step.
Right.
And oftentimes, what happens is well-intentioned people will give you advice like, you should do this or you should do that, or I did this when I had
Mhm.
cancer, or my friend did this. And as a breast surgeon, I say there are so many different types of breast cancer. We treat your cancer based on, your type of
Mhm.
cancer. And
Mhm.
so it's a very personalized care for you. It may not be, different than what your friend had.
Right.
And so how would you approach that, something like that?
Boy, that's a wonderful question, fabulous question. So for some people, talking about
Yeah.
it is therapeutic.
Yes. Okay.
So
Okay.
there are some people that they want to tell you that they're okay or they're
Yeah.
going to be okay or they love their
Yeah.
surgeon and they want to talk about you
Yeah.
or, somebody in their care team.
Yeah.
That's all a good thing. For most people though, that
Yeah.
becomes overwhelming,
Yeah.
especially as you do what you say, you
Yeah.
repeat over and over and over
Yeah.
in a short amount of time. Um most of the time, there's a sweet spot right in the middle where you say just enough to feel polite and politeness is a big part of this too, by the way.
Yeah.
We feel like if somebody we're conditioned, if somebody
Yeah.
asks us a question, we
Yeah.
politely look at them and
Yeah.
respond and
Yeah.
answer all their
Yeah.
questions, even if we don't have the answers,
Yeah.
even if we're anxious.
Yeah.
We tend to sacrifice ourselves
Yeah.
and our own thoughts and feelings for the sake of the other.
Right. Right.
I think find the sweet spot. I've got to be honest with you. I was diagnosed in December 17 years ago, and I
Oh,
always say
wow.
that for people
Yeah.
that are looking for,
Yeah.
somebody that's done it a long time or was diagnosed a long
Yeah.
time ago. That's
Yeah.
me. It was around this time of year, and I had a lot of anxiety and didn't do well with the anxiety and talking about it all the time. So I even practiced with my husband and would say, "Can I rehearsed a little bit
Yeah.
what I wanted to say, just the snippet that I felt comfortable with.
Yeah.
You are exactly right. People want to tell
Yeah.
you what to do.
Yeah.
It's kind of like anything. If you're moving
Yeah.
to a new city that somebody's familiar with, if you're
Yeah.
pregnant, if you're getting married, if you're
Yeah.
getting divorced, if
Yeah.
everyone that's ever been there feels like they have
Yeah.
agency to tell you what
Tell
to
you
do,
what to do.
and they
Well,
don't.
well intentioned, but
Very well
yeah.
intended.
Yeah. Yeah.
So I typically try to tell people find the amount of information and it's okay to say, and this is how you say
Yeah.
this, enough about me. I want to hear how you're
Oh,
doing.
that's a good. Yeah. Yeah.
So just make that transition. Like I feel like all we're talking about is me.
Yeah.
I'm doing great.
Yeah.
I'm ready to, party or have a cocktail
Yeah.
or a fun dessert. And I want to hear all about you and
Yeah.
your family.
Yeah. That's a really great way to
Yeah.
kind of segue, or
Yeah.
take the pressure
Right.
off of yourself. So,
Right.
and delegating tasks, as women, we're so terrible about
Oh,
delegating, right? I'm definitely not good about it.
yeah.
And that, would you consider that to
Oh,
be an important thing? Yeah.
yes,
Yeah.
especially so a couple things. For some people, they feel defeatist if they don't do everything they've always
Yeah.
done. Make grandma's cranberry salad, decorate the tree
Yeah.
perfectly with all the
Yeah.
ornaments, all the shopping, all
Yeah.
those kind of things. Again, there's a sweet spot.
Yeah.
So delegating is great
Yeah.
if you can let go of the reins a little bit. You have
Yeah.
to, and I know you understand this, but for a lot of people, they don't feel like they have any control,
Yeah.
and that's a way to keep their control.
Right. Right.
So my suggestion with that is this the time to bring in a family member that starts a new tradition?
Oh,
Is this the
yeah.
time to say, "Hey, everyone, let's put up the
Yeah.
Christmas decorations together.
Yeah.
Hey, everybody, who wants to have a wrapping party?"
Yeah.
Who wants to all have a cookie making party?
Yeah.
Something that you're still part of it,
Yeah.
so you're not completely delegating it, so you keep control.
Yeah.
So you're the foreman of the cookie making brigade, but
Yeah.
you are sharing that responsibility
Yeah.
because you're gonna be tired, and
Yeah.
that's the one thing too to remember, anxiety is exhausting.
Right. Right. Right.
It's
Yeah.
exhausting.
Yeah.
I always say we have a three-ring circus in our head that just keeps going,
Yeah.
and we're tired, and it'll wear us out
Yeah.
fast.
Yeah.
So anything we can do to keep traditions and all of that, but delegate to a place where we feel like we still have some
Some
control.
control. You're absolutely right. And you bring up a great point. When you get told you have cancer, you lost a lot of control in life.
You lose it.
And now to say, okay, give up this or that, I think you feel like you're defeated. And you're right that you bring up a really great point in keeping control in things that we can control.
Mhm.
But making sure that you're not getting exhausted with
Right,
that. Yeah.
right.
And you said this, but like setting boundaries, I think it's an important thing. Don't you agree with?
I
Yeah.
do. I
Yeah.
mean, the thing about boundaries is that boundaries kind of gets a bad name
Yeah.
because for most people, when they say, I'm going to set a boundary, they think maybe that somebody, they don't want the relationship.
Yeah.
It's a distance because the relationship is harmful
Yeah.
or it's not serving them. Absolutely not.
Yeah.
Boundaries are healthy.
Yeah.
Boundaries might be, listen, I can come to your party, but
Yeah.
I have a hard stop at 8 o'clock
Yeah.
and it's because you need time to go home and unwind and just get ready for bed, do your
Yeah.
routine.
Yeah.
If meditation and breathing exercises
Yeah.
are part of your routine, you have to
Yeah.
have time to do that.
Right. Right. Yeah.
So, mental health is it's not a luxury. It's no
Yeah.
different than taking, aromatase inhibitors
Right. Right.
or your treatment, chemo or
Yeah.
radiation. If you prioritize mental health the same way,
Yeah.
you're going to create healthy boundaries, solid boundaries
Yeah.
that can help you take care of yourself.
Yeah.
Boundaries are not just for you though, by the way.
Yeah.
So if you have a friend or a family member who's beside herself or themselves himself trying to help you or
Yeah.
don't know what to do for you, you creating a boundary can help them too.
Right.
So they understand that, oh, I don't need to solve this for you.
Yeah.
I can just be here and enjoy you and I don't
Yeah.
need to take this away because they're
Yeah.
not going to.
Right, right. That's really great point. That's really great point. A lot of these things we're going to talk about today is a similar concept. So, when you're newly diagnosed, I think the challenges are a little bit different. I would say when you're newly diagnosed, the waiting to get
Mhm.
the hormone receptors back, waiting to get the result, pathology results
Mhm.
back, waiting for surgery, waiting for pathology from surgery. Do I need chemo? Do I not need chemo? All those things is the whole waiting game is just so hard.
Mhm.
And, there's again, like going back to what you said, control what you can, but then, you can't control everything and know
Mhm.
that you just have to expect the best in the meantime, do things
Mhm.
like you talked about mindfulness, journaling, and delegating. And
Yeah,
yeah,
movement is
yeah.
helpful. Those are the things I encourage my patients to find those things that they can put in their toolbox, and I actually call it a toolbox
Okay.
and say, what are the things that you can go to
Yeah.
that really help you manage
Oh,
anxiety
I
and
love
make
that.
them a
Yeah.
priority.
Yeah.
So if taking a half hour walk a day is important, put it in your toolbox and that becomes a priority.
Yeah. Yeah.
Um, again, there's limited amount of time.
Yeah.
And especially this time of year, if you're waiting for a result, if you're
Yeah.
if you're waiting for a treatment plan, if
Yeah.
you're just in the queue and you know you're going to have surgery
Yeah.
January 2nd,
Yeah.
it's okay not to be, sunshine and
Yeah.
rainbows for the holiday. It's
Yeah.
just be kind to yourself.
Yeah.
Lean into it. One of
Yeah.
the most important things I tell people is you're not going to feel like this forever.
Yeah. Yeah.
I mean, we're a tribute to that.
Right.
Look how
Right.
we're talking
Yeah.
about that.
Yeah.
And there was a time
Yeah.
in my life when, especially this time
Yeah.
of year, I had a hard time,
Yeah.
frankly,
Yeah.
with my normal life,
Yeah.
working, taking care of my
Yeah.
kids. My
Yeah.
kids were young at the
Yeah.
time. Um, Focusing on all the jobs and all the tasks that
Yeah.
I felt like I had
Yeah.
to do. But it doesn't last
It
forever.
doesn't last forever.
It
Yeah.
doesn't.
Yeah.
It's a
Yeah.
truly anxiety is a neurobiological response.
Yeah. Yeah.
You sense something is uncertain,
Yeah.
unsafe, even though you might have the most wonderful doctor in the world telling you you're
Yeah.
going to be okay.
Yeah.
You still are scared, and
Right.
that's going to make
Yeah.
you anxious.
Right.
You're still uncertain,
Yeah.
afraid of the future,
Yeah.
especially if you have children.
Yeah.
So have realistic, kind expectations for yourself.
Yeah.
You know, the more you can appreciate that this is temporary, it's going to pass, and it's okay that I feel this way
Yeah.
because my brain is taking care to protect me from anything else
Yeah.
bad that's going to happen.
Yeah. That's a really great way to look at it. And we'll come back to the toolbox because I want to put things in the toolbox to give it to our people today. So newly diagnosed cancer is a little bit different during the holidays or any time of the year. It doesn't matter. It doesn't have to be during the holidays. But someone now, taking a step forward, like someone who's going through treatment, someone who's getting chemotherapy, someone who's getting radiation, their taste is different. They're
Mhm,
tired. They have to take care of themselves. They can't attend all these gatherings and family
mhm,
events. And
mhm.
how do you think they should respond in situations where they get invited to all these holiday parties and things like that?
So I this is a very common question.
Yeah.
People deal with this a lot because again, they feel rude
Yeah.
or ungrateful that they've been invited.
Yeah.
So it's very important to prioritize within your own family and your own what you like to do,
Yeah.
frankly. If you love to go look at Christmas lights, then make that a high priority.
Yeah.
It's okay. It's not selfish.
Right.
And if you don't go to the annual Christmas party in your neighborhood, you'll go next year.
Yeah.
And again, you can set those time limits and say, I can just come
Yeah.
for a little bit
Yeah.
because I need to decom. And here's the thing, nobody's going to really question you too
Yeah.
hard about it.
Yeah.
I was so afraid of that,
Yeah.
that somebody was going to be like, why? Why aren't you coming? Why aren't you staying? Why
Yeah.
aren't you?
Yeah.
Nobody's going to question you.
Right. Right.
It's an open house most of the
Yeah.
time. So
Yeah.
you stop in. If you don't feel like going and you don't feel well, it's temporary.
Yeah.
It's not going to be like this forever. Your taste is not going to be like this
Yeah.
forever.
Yeah.
Your exhaustion and apathy maybe for the
Yeah.
holidays,
Yeah.
it's this is a special circumstance. It's
Yeah.
not, you're not defeated, you're not
Yeah.
it's cancer's not winning, it's not
Yeah.
beating you. We
Yeah.
use those terms so frequently like it's
Yeah.
a fight,
Yeah.
and for some people they really rally around that. Other
Yeah.
people that makes them feel guilty, like they're not a
Yeah.
good fighter.
Yeah. Yeah.
They're not fighting
Yeah.
well,
Oh,
excuse me.
yeah.
So what happens is then they just overdo and overdo and
Yeah.
overdo.
Yeah.
And here's the thing, when you don't respect your boundaries for yourself, the way that your body is going to tell you enough is it's going to be anxious.
Yeah.
You,
That's
you're
a good point.
you're not going to get, your taste isn't going to get any, worse. Your exhaustion is probably going to be about the same.
Yeah.
Something's got to give.
Yeah.
So you start to feel anxious because you're starting to feel out of control
Yeah.
because you don't have those things in your toolbox, the breathing, the journaling. Journaling is magic. It
Yeah.
really is.
Talk to us a little bit about journaling.
Ah, I love journaling.
Yeah.
I,
So I actually, before we get to that, I do want to talk a little bit about loss. I've had a loss in my life.
mm,
My mom passed away 2 months ago,
I'm
and
so
I've been,
sorry.
thank you. It's one of those things I can't describe it how it feels like other than like a hole in your heart.
Mhm,
I have both my parents are now gone. So what was really impressive to me, I have always journaled, but during this last couple of months, I've been journaling more
mhm,
and writing stories and all the
mhm,
things I remember growing up. I
mhm,
cannot tell you how therapeutic that has
mm,
been.
mhm.
And so, how do you like? What do you recommend with journaling?
So for some people, they are very comfortable with just saying, Deepa, just
Yeah,
write about whatever's on your
yeah,
heart.
yeah.
For other people, they like prompted journaling,
Okay.
so they'll need something, a prompt.
Yeah,
How do you feel about the holidays
yeah,
without this person?
yeah.
Or you can find there's a no shortage of journals that'll
Correct.
give you
Yeah,
prompts.
yeah,
Um, I tend to think a really great journaling practice is storytelling.
Yeah.
So either leaving a story for somebody else that you want to
Yeah.
describe the loved one,
Yeah. Yeah.
describe the loved one
Yeah.
to someone else. I also think, legacy journaling, leaving
Yeah.
for my daughter and son-in-law for my birthday this year got me a program where I get a prompt every week and then I write to my grandson.
Oh,
And so
that's
it's
awesome.
it's something that and it'll be like, "Tell us about, the first time you flew on a plane," or
Yeah.
tell it, and it's sweet
Yeah.
and it's fun and it's therapeutic. But
Yeah.
again, that's a neurobiological,
Yeah.
neurophysical process.
Yeah.
Writing activates different parts of the brain.
Yeah.
And so, much like if you've ever known anyone that's had a stroke and they can sing, but they can't speak,
Yeah.
writing is a completely different activation in the brain that's very
Oh,
calming to our nervous system.
yeah.
So if you need a prompted
Yeah.
journal,
Yeah.
find one. You'll find them
Yeah.
no problem online.
Yeah.
But I like just to, I
Yeah.
like to write letters to people even if they're not there.
Yeah.
Um, I like to communicate through writing, and I will tell you, it's way better to write than it
Then to
is to
type.
type
Yeah.
and to
Yeah.
text. Writing, the
Yeah.
physical act of writing is
Yeah.
very
It's so much good.
important.
Yeah.
I know people that'll leave a place for someone,
Yeah.
at the table at the holidays that's
Yeah.
gone.
Yeah.
I know people that'll make a favorite recipe. This was
Yeah.
grandma's fill in
Yeah.
the blank, and we're
Yeah.
gonna make it in honor of her.
Yeah.
I would say though, that this is gonna get better too,
Yeah.
but it would be unrealistic to expect that you're not gonna feel that hole
Yeah,
extra big in your
yeah,
heart right
yeah.
now.
You know, uh, you're saying storytelling is important. That's what I've been doing is I get up at, 4:30. I've been journaling and like talking about all the things that have happened and the impact of
Mhm,
my parents on my life. And I just like start crying and the tears
mhm.
just start flowing. And I do think it's so therapeutic,
Oh,
to put that on
it's
paper.
cathartic,
Yeah,
yeah.
and for my kids, for me personally, I just feel like I don't want my kids to forget them, and I think
Mhm,
that's the biggest part of doing that.
mhm,
So
mhm. And that's
yeah,
such a gift that you're giving to them,
yeah, yeah.
you know? That's
So
helping you, but you're really giving them the gift.
yeah, and that's I think I'm sure it probably happens to others too. Is I just don't want them to be forgotten, and so for me,
Mhm,
storytelling, writing on a piece of paper so that they can read about them,
mhm.
it's been really important.
Oh, love that.
What else? What else would you say?
So the probably the really another really important thing that I'd like to mention is this seeking help.
Yeah,
It's okay. It's funny because when you're some of the busiest times of the
yeah,
year,
yeah,
you're thinking, "Oh my gosh, there's no way I could squeeze in another
yeah,
appointment." But it doesn't have to be traditional therapy. It can
yeah,
be asking somebody that you trust
yeah,
and say, "I could use some help." And
yeah,
it's not the cookie brigade that I was, referring to
yeah,
earlier. It's just a trusted friend or family member,
yeah,
neighbor, somebody that you know
yeah,
cares about you that is just able to come in and just help,
yeah,
whether it's the person you call when
yeah,
you're feeling slightly anxious or greatly anxious. I find that there are people that are really afraid of talking to somebody
yeah,
because they want to solve it and they don't know what to do. So they
yeah,
kind of their anxiety kicks up and then
yeah,
everyone's anxious.
yeah,
But I also find that there's people, and you know the difference, and you definitely know the difference in people in your
yeah,
life that are just they're easy,
yeah,
calm, their nervous systems. I
yeah,
mean, we all have these things called mirror neurons.
yeah,
And essentially, like right now, our
yeah,
mirror neurons
yeah,
are their mirror because they're reflecting,
yeah,
they're assimilating to each other.
yeah,
And we do that in, with friends, with family,
yeah,
with people we meet. If there's someone that you feel if professional help is always a good idea,
yeah,
but if that's not possible,
yeah,
just find somebody and say help.
yeah,
And you don't have to, go into the whole story. The thing about breast cancer, I say this all the time, I had many women that
yeah,
reached around and gave me their hand and helped me through,
yeah,
and now I reach around and give them my hand and help
yeah,
them through.
yeah,
And it's a community and it's
yeah,
a common language.
yeah,
And if you're working too hard to try to describe to someone how
yeah,
you're feeling,
yeah,
they probably don't understand
yeah,
and they might not and move on.
Yeah.
Yeah.
Right. Exactly.
Mhm.
Exactly. So we've touched on really great topics, how to navigate when someone gets diagnosed with
Mhm.
cancer, whether it's during holidays or not,
Mhm.
what to do while you're waiting, and, if you're going through active treatment or if you've had a loss. And what I want to, for our audience here, give them a toolbox. And you mentioned that.
Mhm.
And I just want to kind of mention the different things that they can pull from this toolbox to use
Okay.
it in their life. So, Abid, you talked about journaling, and that was
Mhm.
beautiful in how you described it. Mindfulness.
Mhm.
Would you consider that to be part of the
Yeah.
toolbox?
It's funny. If I said to you, Deepa, when you get up in the middle of the night tonight to, get a drink of water, are you going to wash your face and brush your teeth? And you'd say, no, I
Yeah.
don't do that in the middle of
Right.
the night.
Right.
I do that before I go to bed, or
Right.
I do that when I wake up.
Right.
We all have habits that are based
Mm,
on arbitrary rules. There's
yeah.
no reason you
Yeah.
couldn't do that.
Right.
Nothing
Right.
bad would happen.
Yeah.
Mindfulness and meditation and those yoga, um, they call it forest bathing or just being out in nature. Those are all things that if we do them when we're not in a state of anxiety,
Yeah.
they become it's very they become part of
Part of
our
yourself.
of
Yeah.
our of yourself, of
Yeah.
your infrastructure, and you can go to that well
Yeah.
easier.
Yeah.
So I would say a great thing to put in a toolbox is a mindfulness or a meditation practice.
Yeah.
There's apps,
Yeah.
many of them. Calm, Headspace, they have
Yeah.
free versions. That's all you
Yeah.
need. There's guided meditations,
Yeah.
just like guided journaling.
Yeah.
There's also, you can find a mantra
Yeah.
and just repeat a
Repeat a
mantra
mantra.
for a minute. It's
Yeah.
this These are not things where you need to go to a special
Yeah.
anything.
Yeah.
Five fingers, here's someone that loves me unconditionally. Here's someone I love unconditionally.
Yeah.
Here's,
Yeah.
a great memory.
Wow.
All those kind of things that you can
Yeah.
just ground.
Yeah.
What do I see, smell, hear, taste, touch with the
Mm.
five senses? I worked years ago with a surgeon,
Mm.
and this person was really struggling being anxious in the operating room,
Mm.
but they couldn't leave. They
Yeah.
couldn't leave, as you
Right.
know.
Yeah.
So we worked on things that they could do just in that moment to help ground them in a
Mm.
moment. So if you're at your kids', holiday
Mm.
program and you start to feel anxious and overwhelmed because so many people have come up and asked how you are,
Yeah.
you can take a minute and just say, what's something I smell, taste,
Yeah.
touch, feel,
Yeah.
hear?
Yeah.
Who are some people that love me that I love and why?
Yeah.
You can take these little breaks in your mind, and if you practice them on a daily basis,
Yeah.
just like anything,
Yeah.
they're going to be more readily available to
Yeah.
you.
Yeah.
The other thing I would say is, and I've done this with clients where I've taken a shoebox, they'll bring in a shoebox, or if I have a shoebox, I'll have a shoebox, and we actually put things in there.
Mm.
Scents, is there, is lavender
Mm.
comforting to you?
Mm.
So we might take lavender and put it on a cotton ball and put it in the
Mm.
tea.
Yeah.
A mindfulness, a
Yeah.
meditation
Yeah.
or something. It can be something that tangible, a
Yeah.
stone, the
Yeah.
tactile. People really like this means a lot to them.
Yeah.
If it's a religious piece or a
Yeah.
relic, and you
Yeah.
take that, if it's a
Yeah.
cross, if it's
Yeah.
anything that just
Yeah.
brings you comfort, the more you practice
Yeah.
associating your mind
Yeah.
with that piece, the quicker you're going to go there. So if I'm
Yeah.
starting to feel activated, where's my box? I go to my box. Okay, I'm going to calm down.
Yeah. Oh, wow. That's very interesting. I find myself wearing like my mom's bracelet, like
Mhm.
often, and it
Mhm.
calms me down. I feel like she's
Mhm.
present with me.
That's
And
exactly what I'm talking about.
I can totally understand that. And then on the weekends, I do try to get out when there's sunrise, if there is
Mhm.
sunrise.
We're in Ohio,
We are in
so
Ohio, so yeah.
not right now.
Yeah, but that has really helped me a lot. And so when you
Mhm.
say forest bathing, I think there is something to that. Getting out in that air, breathing that fresh air, getting that light on your face, and being outdoors, praying, meditating, listening to podcasts, listening to
Mhm.
music has really been therapeutic. I get a lot of my great ideas as I'm outside,
Mhm.
and I come back with all these topics that I want to talk about for my podcast. And so it's really unbelievable. If you live in a place where there's sunshine, take advantage of that. Go out
Mhm.
every day if you can. I think it's free therapy.
It is, it is,
So,
and
yeah.
the other thing is
Mm,
this tapping.
mm,
We know that the brain likes bilateral stimulation. So EMDR therapy, which is trauma therapy, is actually bilaterally stimulating your brain. And in session, the traditional, if you've ever seen, there's certain times you'll see it on TV or a movie, somebody will do it, or if you've had it done where you're moving your fingers and it's the eye movement. EMDR stands for eye movement
Okay.
desensitization reprocessing, but it's really bilateral movement. So walking,
Uh-huh.
running, this
Oh,
kind of stuff, tapping on it's very calming and soothing to us.
oh, wow.
It's similar
Yeah,
to a baby finding their
yeah,
thumb
yeah,
or doing a rocking motion, or my grandson will play with his hair.
yeah,
It's a soothing activity that
yeah,
calms our nervous system down.
yeah,
I say this all the time. What we know about the brain and mental health is we are truly in the dark ages of this.
yeah,
There's so much more to discover.
yeah,
But we know that through scans and different studies that bilateral stimulation is very calming.
yeah,
So in my case, because I know this, if I tend to feel like I'm starting to get activated,
yeah.
I'll just do, and I can do it subtly, I can do it on my lap,
Oh, wow.
and it
Okay.
just is you can buy really expensive tappers. I know for kids sometimes with autism spectrum disorder or other neurodivergent that get really activated.
Yeah.
You can buy these, vibrators that they
Mhm.
put in their pockets or their socks
Oh,
that
wow.
calm them
Yeah.
down. But you don't need to do anything like you can just,
Just tap your
walk.
yeah,
I
yeah,
mean, think about like, centuries ago in
yeah,
indigenous tribes
yeah,
that would drum. If
yeah,
somebody died in the tribe,
yeah.
they would have a drumming
Oh, yeah,
ceremony and
yeah,
they would dance and
yeah,
they would
yeah.
it really does have those origins.
Yeah. Wow. I did not know that. That's really first time I've heard of this. This is
Good,
great. Yeah. Thank you
good.
so much.
You're welcome.
You're giving us such great tips. You talked about mindfulness and, journaling and EMDR. Is that what you said? That was like
Or
the
just bilateral
bilateral
stimulation.
bilateral
Just
stimulation.
tapping. It's the
Yeah.
best way to say it.
Yeah.
Just back and forth something.
And anything else you would like to add?
Just be kind to
Yeah.
yourself.
Yeah.
It's not forever.
Yeah.
And when I was highly, highly anxious and very, very afraid of recurrence and just what had just happened, and
Yeah.
I had bilateral mastectomy, what had happened in my body,
Yeah.
I I think the times when I was the most anxious is when
Yeah.
I was afraid that I was never gonna feel quote unquote normal again.
Yeah. Yeah.
And I hear that all the time.
Yeah.
And I just say, I'm gonna hold a space of hope for you
Yeah.
while you can't hold it for yourself,
Yeah.
but know it's there.
Yeah.
It's okay to believe you're gonna feel better. It might not be this holiday,
Yeah.
it might not even be the next holiday,
Yeah.
but I'm pretty sure you're gonna feel better
Yeah.
next holiday than you do
Yeah.
right now,
Yeah.
especially if you're in the
Yeah.
middle of it. So hold some
Yeah.
hope and be kind
Yeah.
and gentle to yourself. Don't expect yourself to do these heroic things
Yeah. Yeah.
that are just going to cause you the byproduct, the residue, the hangover will be anxiety from
Yeah.
something like that.
Absolutely. Yeah. Wow. Those are all such great tips.
Good,
And yeah, these are so helpful.
good.
And I think what you said really hits home is be kind to yourself. We are so
Mhm,
kind to others. We're kind to
mhm,
our kids. Use the same sort of love and kindness for yourself and
for
take
sure.
care of yourself. And you have given us a lot of great tips how to
Good.
navigate through
Well, I
holidays
appreciate
with
the
grief and
opportunity.
loss. And I really appreciate it. Amy, what's amazing as I'm talking to you, I was thinking how things that happen to us, how we can make it, like you had breast cancer, I had breast
Mhm,
cancer. We are using that story to create a positive
mhm,
impact for people.
mhm,
And the main goal of this podcast is to educate and empower people,
mhm,
so they can advocate for themselves. That's
mhm.
really what this is all about. And I'm so grateful for you to being on here today, giving
Thank
up
you.
your time with your family to be here. I really appreciate
Thank
it.
you.
And happy holidays.
Thank you.
How can people find you, Amy?
So I have a partner, Jody Gibbs.
And she's been
She's been on the
on our
podcast.
podcast.
She
Yes.
works with Dr. Halaharvi
Yes.
at Ohio Health. We have an office in Columbus, Ohio called Vibe, is the name of our practice. It's a women's health collective by Enliven. So we are in close to downtown Columbus, but we see people virtually. We take all insurances. We want to make ourselves very accessible. So, especially if you're struggling with health anxiety, I don't know if you put links to your.
Yes, yes.
Yeah.
And I have the links from
Yeah.
Jody Gibbs, and we can
So
use
we can
those.
put
Yeah.
that in.
Yeah.
It would be an honor to, I mean this sincerely. There's a thing called post-traumatic growth.
Yeah.
So we think about post-traumatic stress, and it is stressful. And having a cancer diagnosis
Yeah.
is traumatic,
Yeah.
especially when you hear that,
Yeah.
especially if you're afraid of it the way I
Yeah.
was,
Yeah.
because we had a family history of it. But there is post-traumatic growth, and I think we are
Yeah.
embodying that.
That's exactly correct. Yeah.
We've taken this thing,
Yeah.
and again, it's that turning back and giving your hand to the next person
Yeah.
to come through.
Yeah.
And I'm humbled and honored every day to have women that trust
Yeah.
me to try to help them through
Yeah.
this journey.
And what an honor to have you here in Columbus, Ohio.
Oh,
It's really difficult to get into, mental health therapists and the psychotherapist. So we really appreciate that you're here.
Thank you.
I'm very grateful for what you're doing and Jody Gibbs is doing. She's been on the podcast. She talked about body image. We talked
We
about
talk
hot
about
flashes.
that a lot.
Yeah, and she's coming back to talk about sexual wellness. That will be coming out for Valentine's Day next year. So
And we do, we will,
Yeah.
we do groups, we
Yeah.
do workshops.
Yeah.
We have a fear of anxiety workshop
Yeah.
coming up next year that, it's people, it's just a community. We're just trying to
Yeah.
create a community that doesn't feel sterile
Yeah.
and scary. When you come in, we want you to feel like you're in our home.
Yeah.
And we are very close and good friends, and I think that comes through
Yeah.
too.
Oh, that's
So,
awesome. So before we close, what are your secrets of wellness? Meaning, what do you do to take care of yourself?
oh, wow. Great question. I mean, for me, I'm a runner, and
Wow.
so I love to run, and I think it's always cleared my head.
Yeah.
So movement is important to me, but I
Yeah.
also need to, I will be honest, I'm on a yoga mat at least 2, 3 times a week.
Okay.
It helps calm down my nervous system.
Yeah. Yeah.
I love to journal and write. I love time with friends and family.
Yeah.
But
Yeah.
I feel very called, and I feel very passionate about doing this.
Yeah.
So for me, this is
It's given you a
therapeutic.
purpose.
I have a
Yeah.
tremendous purpose
Yeah.
that I
Yeah.
really didn't
Yeah.
have
Yeah.
professionally.
Yeah.
So
Well, that's wonderful. Thank you so much. You're
thank
also
you.
practicing what you're preaching, is what I'm hearing here.
Yes. Oh
And
yeah, I do all
so,
that stuff. My
yes.
clients
Yeah.
will say, they'll say, I know that you do this, and
Yeah.
I know you think it's a
Yeah.
good idea. And I'm like,
Yeah.
I know everybody doesn't want to run, but if
Yeah.
you can run, it's great.
Yeah.
I love
Yeah.
being outside,
Yeah.
and
Yeah.
so it's
That's
great.
wonderful. Well, thank you so much,
Thank
Amy.
you.
And I'm going to put your information on the
Great.
website so people can know where to find you.
Awesome.
And it's such an honor to have you here.
Thank
So
you.
thank you
Thank
so
you for
much.
what you're doing.
And I hope you have liked this podcast. This is like full of such great information. I've learned so much talking to Amy today. And her information will be on the website, on the podcast, as well as the YouTube. And if you like this, please share with others. This is such a good podcast and such great wealth of information. And find Amy.
I'd love it. I really would.
She's here
We
in
have a
Columbus,
lot of fun.
Ohio.
We
Yeah,
do.
yeah, yeah. Thank you all so much for watching. And if you like it, please give us a 5-star rating and share with others. And thank you so much for taking the time to be with us today.
Thank
Have
you.
a great day.
Thank you.
Bye-bye.
Happy holidays.
Happy
Bye-bye.
holidays. Bye-bye. Thank you, everyone, for tuning into the Breast Cancer Podcast. Remember, you're not alone in this fight. I encourage you to be an active part of this podcast. Please share your stories, questions, and suggestions for future topics at my website called drdeepahalaharvi.com. And please share this podcast with others, especially if you found it useful. And please also give it a 5-star rating, if you will. Stay connected as we navigate the complexities of breast cancer. Until next time, take care and keep shining brightly. Disclaimer: this podcast is not intended for complete medical advice.